for the navicular drop test, this is also talk about supple foot testing for the NPlex, and what it is basically checking for the arch, the height of the arch. So this is we also call navicular drop, and this is the card from foot levelers that we use in the manipulation 1 class. What you want to do is that you want to make sure to find the location of the navicular. So usually there's a medial malleolus kind of going to a little bit in the anterior. There is the navicular bone right here. So you want to measure it right on the navicular bone. You can go at the tip of the navicular or at the bottom of the navicular. I usually go to the bottom of the navicular. Sometimes just going to put my finger there. And then this is going to be for the right foot. Just measuring right now. Let's see. It's like a 45. So on the seated position, non-weight bearing 45. You can just write that down there. And then ask the patient to go ahead and stand up. Don't move this yet. And then for him, actually went down to just a little bit. Not too bad though. It's almost like 40. So went down 40. And then the differences of the drop is 5. Usually 5 is like mild. If it's the difference is greater than 9 or 10, which is like 1 centimeters, then you will kind of note the patient that it will be possibly the patient might need a little bit support or doing a lot of rehab. And that's the rehab that we taught in a Manip 1 class, to do a lot of contraction of the plantar muscles. Okay, next.
Thompson?
Thompson's test. Let's see. Thompson's test is for checking for the Achilles. What you can do is that you can also do the seated. Go ahead and scoot back. You can check on the seated. The way you seated is you're gonna squeeze, and it's checking for the plantar flexion. As long as you squeeze it and it goes into plantar flexion, the Achilles tendon is intact. A lot of times though, practitioner will do in a prone. So ask the patient to lay on the stomach, and then checking for the plantar flexion of the foot by doing this. So you will be squeezing the calf, and then you are checking. If there's a cut in the Achilles tendon, it's not going to be going to plantar flexion. If it's the partial tear, patient will note the pain. There will be a swelling. They will still be able to do the plantar flexion with squeezing on the calf. Okay.
Tibial torsion?
Tibial torsion test. What I said. Tibial torsion test is actually for the pediatrics, so it's not for this patient and an adult. What you're checking is that tibial torsion test is that you're looking for the line between the medial malleolus and lateral malleolus. So what you want to do is find those two areas, drawing the point in the middle. You're going to draw this line all the way to the tibia, right here. And then from the tibia going to the patella, in the middle of the patella. This line, usually on the kids, will be, this is like a whole section of the tibia and tibial line right here. It should be within like maybe 0 to 15 degree, about like lateral rotation, external rotation. However, some kid, this line gonna be, so this is the line going to from the tibia down, and this is this is the perpendicular line right in here that are going to the medial malleus and lateral malleus. If this line goes tip in, sometimes that will happen on the pediatrics, and this will be internal rotation of the tibia. And if the internal rotation of the tibia happens, then the whole foot is going to go in, and this will create the intor walking gait patterns, and those need to be corrected. Sometimes what I usually do is I'll check if the motion of the tibia and the fibula, checking for the restrictions in the distal and the proximal, the tibial fibula head, and if those need to be manipulated, do that. There's a really good osteopathic technique to balance the internal and external rotation of the tibia. Those would be really good. If those doesn't help, then they might need to be with a physical therapy, with a gait training, or sometimes you need to do the casting to help. Okay, so that's
the forefoot adduction correction.
Forefoot adduction correction is, again, this is for the pediatrics. So the pediatrics, sometimes when they're born, their foot is totally in like this. What you're going to do the forefoot abduction test is that you're going to actually push from like medial to lateral. Okay. forefoot is from the digit and part of like, so forefoot is like all the digits, part of the foot. Midfoot will be like coming into, and also the metatarsal part of it, but midfoot is coming to the, those cuneiforms, naviculars, and cuboid and those guys. And then rear foot is the calcaneus and all that. Forefoot right here on the top part of it, if you try to move from medial lateral, and if it doesn't move, then you need to refer for the casting, and then move the foot back into the neutral place. If it's a forefoot adducted, and if you push the medial lateral, and if it moves back more on the neutral position, then you probably don't need to get a casting. So you just need to observe how much you can push and put it back in the neutral position. Okay.